Welcome, everyone. Today, we are starting an exciting new segment calling it 5 Minutes with a Therapist. And today's topic is going to be about autism. I have Pierre Mata with us. He is a senior clinician with Family Houston. So if you have any questions about autism that you would like answered, you can just comment below, or you can message us privately and we'll get those answered for you. So with that being said, since we only have 5 minutes, I'm going to jump right in. So Pierre, thank you for joining us today.
Thank you.
Let's just go ahead and start with something simple. Can you explain exactly what autism is?
Autism is a neurodevelopmental disorder, and that basically means it's based in the brain, and it primarily affects speech, social interactions, and then a lot of times there will be kind of like very rigid and persistent obsessive types of behaviors, and obviously that can be very problematic or bothersome. It's now called. It used to be called just autism. Now it's called Autism Spectrum Disorder, and the reason for that is because you can have anywhere from a severe impairment and or all the way to very high functioning, and so they decided to classify it along the spectrum because it can present in very many different ways in children, teens, and adults.
Okay, all right, that's really helpful. Thank you.
Mm-hmm.
Can you explain how exactly it's diagnosed?
So usually you will, you will take your child, for your regular checkups to a pediatrician. And so very often you might report some things that you're noticing about your child, like, things like repetitive behaviors, sensitivity to light, sounds, not looking you in the eye. And so they will, the pediatrician will recommend a evaluation. And there are different types of evaluations. Some can be done by a pediatrician, but who specializes in things like diagnosing autism. And of course, clinical psychologists will also run tests for things if they suspect autism. So you would want to your doctor, or your regular doctor, PCP, pediatrician, and even a therapist might say something, but you definitely don't want to just make an assumption that your child has autism unless they have been fully evaluated, psychologically evaluated and tested.
I think that's a really good point. I think sometimes we just label without having a professional opinion, or just assume because the child might have one symptom that it must be this. So I think that's a really good reminder that professional needs to be the one to do the diagnosis.
No, and there are the testing now is becoming very specific. So there are specific tests for autism that would accompany, because they're not just going to look at that particular, they're going to look for learning disabilities. They're going to look for, other kinds of issues, anxiety, depression, IQ. So it really is good to get a full psychological evaluation if you're concerned.
Okay. All right. Thank you. Mm-hmm. Is it known what are the causes for autism?
So I try to keep up with the research, and I was even looking this morning. And the simple answer is no. We really don't know exactly specifically what the cause is, but we are getting better at narrowing it down. And so far, what we are realizing is that there are definitely genetic contributions. So, in the presentation of certain mutations and things like that. But also there are environmental factors that can contribute. And when I say environmental factors, you have to be really careful because there's a lot of information out there on the internet, like that this causes autism and that causes autism. So I'd be very careful about what you might presume might be contributing to it, because it really is it's kind of like a combination. Definitely there's a genetic. For example, if there's one child in the family that has autism, it is likely that another child in the family will. If there's a father or a grandfather or something that has it, And I'm mentioning men because it presents more in men than it does in women, in males than females. And so that's a huge part. But there are other things like different kinds of viral infections. I saw today gut health can impact the development of autism. So there's a host. It's very complex, and so you definitely want to again. You can do your reading, talk to your doctor, and there are risk factors, I would say. So there are some things that people are starting to say might be contribute. Like, for example, having a child later in life, there is a greater likelihood, and of course, people know that there's a greater likelihood for other kinds of physical issues, developmental issues in children when you have a child later in life. So those are some kind of things. There's some talk about exposure to toxins and things like that. The one thing, though, that I would say that is a big concern for people is vaccines. Do vaccines. And so several years ago, there was a study that found a link between certain vaccines. I think it was the measles vaccination and autism, and that study was debunked about 10 years ago, and yet we're still hearing concerns. So now, again, I'm not knocking people that are very hesitant to give their children vaccines. I just think that you don't want to make the assumption because the research is still not clear. And I would say there's more research for other causality rather than vaccine. Vaccine is like, again, I don't know very many doctors that would say that there's a link between autism and vaccines.
All right. Thank you, Pierre. I think those are all really great points. And, again, if you think your child or you or someone might be able to be diagnosed with this, talk to your doctor, get their opinion and make sure that it's a full diagnosis. And so Pierre, I think that's all I have for you today. So thank you for joining me and talking to me about this topic. Again, if anyone has any questions, just comment below or message us privately, and we'll be back with another topic soon. So thank you all for joining us.